Very good morning to all, and I thank the Seva International team and specifically Sam Parandeji, who has been, continuously interacting on several issues that we do, and it's a privilege for me to be here. And given the time, I think I'll straight away, talk about what we do. Most of you might know what TERI is. So TERI does a lot of things in terms of environment, and we are mostly an organization which talks about a lot of things which nowadays is kind of trending, I would say. So sustainability, or be it climate change, that has been core of TERI for several years now. So to start with, as Uttamji rightly pointed out, what happens in Himalayas, it doesn't stay in Himalayas. And that is what you see here in the map out there is the state of Punjab. And it is basically, if you see, it's an entire Indus basin that is there. And it's almost, the diagram that you see out there is actually representing individual villages within the Indus floodplain. And my work specifically focuses on, the health impacts because of water contamination. So what you see there is very interesting that we find out, because we did this work, along with some of the colleagues in Pakistan also. So what you see there is the entire basin is mapped out, and each of those villages, you see the satellite image on which individual points are mentioned. So that's a kind of, what I take from the previous presenter, the mapping is important. And why this mapping becomes important is also because it leads us to several questions. So what you see here is basically 30,000 hand pump, that is water sources, that have been mapped by our group in the entire Indus basin. And the interesting part that you see here is, out of all the 5 rivers, only one of the stretch seems to be more red or green kind of a stretch, which is the Ravi River basin. Now, this is depicting the amount of arsenic that is present within the water that people consume within these floodplains through hand pumps. And that is where, it also becomes important why this one river seems to be different from others. And that is where we started, trying to study more into it. Now, being from a science background, I actually have been working for almost a decade in TERI. And, so to say, I'm more of a social scientist rather than looking on only the scientific aspects. So what we have been trying to do is study the source of this contamination that is present within the Ravi River basin. And if you see that, the entire stretch that seems to be, impacted or affected is the entire Indo-Gangetic plain. And so what is happening here is, as I said, what happens in Himalayas, it doesn't stay there, it moves into the floodplains. And that is where you'll see a lot of contaminants that are reaching out to the floodplains. It's not a single day event, it has been happening for years, more than 20,000 years back, what sediment has been deposited within the floodplains. And now that is creating these kind of, the health symptoms that you see. Now this is, what you see here is different impacts because of these contaminants that are being consumed. And these are photographs that you see and that we have been doing a lot in terms of Indo-Gangetic Basin in the state of Bihar, wherein people face these kind of severe symptoms. And what has happened, in fact, we have been monitoring a case for almost now 12 years. And when we started, initially in 2012, what we saw in the source that we, based on what we saw in the source in terms of arsenic, we advised the family not to use that water. And what has happened, just last year, we went back to the family, the member who was, I wouldn't say severely impacted 10 years back. Now his limbs have to be amputated because of, the cancer that you see as basically it develops through the long duration of consumption of that kind of water. So this is, mapping gives you a lot of sense in terms of why this happens and what could be, the way out from, if there is some sort of contamination that is present. And why I'm showing you these 3 different villages in the state of Punjab. You'll see one village seems to be very, good in terms of no contamination, almost no contamination, whereas there are villages, there are, almost all the wells which are high in arsenic. So, what we have been trying to do is, it's not that, science is certainly something that we try to deal with to understand the problem, but how do we deal this problem from a community perspective? So what we do is, we are now more into action research that you'll see in most of the cases that we provide solutions which are certainly not because in the market or in the communities, there are no specific solutions that are available to remove these kind of contaminants from the water. So the best way out is to do some kind of field intervention to educate communities out there so that they start avoiding these kind of wells or water sources. So what you see here is an example wherein, it's typically what people have understanding in terms of contamination as deep water is safe, which in this case doesn't seem to be the case. So, the variability that is there in water is very, very heterogeneous, and until and unless you map it at a very local scale, it's impossible to provide solution. So this is a intervention that we did with a family in Punjab, where the family had a very deep borewell with very high amount of arsenic. And based on the mapping that we did for the entire village, we asked the family to, not lower down, rather bring up the pump which is pumping the water. And that is, you see it is around 20 meters depth, which is blue bar in the 3rd graph. And this we have been monitoring for almost 4 years now, and the family is still using this water, which is low contaminated water. So that's kind of, I would say, intervention that are required on the field. Now this is something, again, as I said, it is more something more community driven that needs to be done. So what you see here is again a village which is impacted. And what we do is we educate these communities or the village households in terms of what would be the health impact and what would be the choice that they need to make in terms of getting a safer source of water. So, these communities are, if you see the 3rd photograph, wherein these community members are being taught to read the Google Earth maps. And these Google Earth maps are basically only the points that you saw in the high resolution maps, wherein they are able to locate where are the blue dots near their households, so that they can reach out to those safer sources, at least, because in terms of, arsenic, it is more drinking of water that is impactful. Rather, it can be used for any other purpose other than drinking and cooking. So what we try to propose is, give them the idea about safe sources of water. Now, this is what we have learned. If we tried this intervention for a year in the village, certain number of villages, and what we found was almost 40% of the families who were consuming, high contaminated water, they actually switched to safer sources of water. Again, this is one example that I would like to highlight as this is a tool that we are trying to design for the drillers, because these are people who actually drill or bore the wells in the villages, and they need to understand what is the safer zone for water. And it is basically a color tool that we are trying to develop, which would be applicable for almost the entire endogenetic plain, where the drillers are made aware of what kind of sediment or soil that while digging you encounter would give you a sense of low arsenic well or no low contaminated well. So based on this color tool, obviously it's something which is in pipeline, which we are trying to still figure out the best way possible for drillers to understand. I think I'll stop here, not go beyond this because the time is up. So thank you very much.